So glad you are still with us, because this is really the meaty part of our program. Senior Action Network has partnered with Senior Services to be part of our South Sound Seniors program for quite a while now.
Quite a while.
Quite a while. And this is our wonderful presentation from the Senior Action Network. And I'm going to just go real quick with names. So Laura Villencourt, and you're a Geriatric Care Manager.
Yep.
And Bruce Bamford, and he is a Medicaid Financial Advisor.
Very good.
And Janet Moody, and she is a wonderful elder care attorney in our community. So welcome.
Thank you.
Thank you.
All three of you part of SAN and have been for quite a long time. And I'm just going to give a little reminder that the Senior Action Network is a group of people who provide services or businesses that reach out to seniors in our community, and they network together, and they also do some great projects in our community, and in turn raise funds that go back and help seniors in our community. And I think you were one of the founders, if I remember right,
Like
Mr. Bamford?
Just yesterday, wasn't
Yeah,
it?
just yesterday.
I think we figured about 18 years ago. I'm not sure. Somewhere in that range.
I think that's about 18 years, yeah.
Yeah.
It's a great program. Thanks
It's
for
a great
getting us
program.
started.
It's been a lot of fun.
Yeah. So, but just last month, you three and one other were panelists at our regular fourth Tuesday morning meeting and did a great presentation and really gave a good example of how members of the Senior Action Network work together to help individual seniors. So what I'd like you to do right now is maybe just do a little quick synopsis of, I gave your titles, but what do those titles, what do you do? What do you really do? So maybe just start maybe with you, Laura, and go down the road.
Yeah. Well, in my business, I actually wear a few different hats. I am a licensed mental health counselor and a geriatric mental health specialist. My main role, though, is as a geriatric care manager. And so in the way that we work together in Medicaid Planning is, as a care manager, my role is to really educate and support families and advocate for them. So when families come to me, I'm educating them about the whole process. Because people sometimes don't understand what a PAR is, a participation fee, or what the case manager's role will be when they get assigned, and how to advocate for their loved one as far as finding a place for them to live. So a big part of my role is really educating families, because when you're informed, you can make the right decision based on your own values and goals. And then the piece that I play a lot with these folks is really helping assess the older adult. I'm looking at the diagnosis and prognosis, and then we're helping to find appropriate placement for them. So I'm looking at adult family homes or assisted living facilities if that's the goal or the need. So
Okay,
Yeah.
great. Thank you, Laura.
you bet.
All right. And maybe, Bruce, as you introduce yourself, you're probably going to do this anyway, but I love to boss you around, so I'm going to tell you, some people may be a little confused about the difference between Medicare and Medicaid. So since it's about Medicaid financing and how you deal with that, maybe you could explain the difference a little bit.
Yeah, it's very, the words are really mixed a lot with people. Medicare is our health insurance. When we turn 65, and we've had health insurance through our career, it's basically at age 65, then we're retired, hopefully, and then we go on Medicare, which is our new health insurance. So it's hospital and health insurance. So that pays for your normal doctors and hospitals and that type of work. But the Medicaid side of it is when people go into a nursing home or go into a facility or need care at home, that care is a whole different world, because that's not covered by Medicare itself. Medicare may cover a little bit of skilled care, but all of it's private pay. People don't realize that when they get out there, if they need care in their home and caregivers to come in, or they go to an assisted living or dementia facility, it's $7,000 to $9,000 a month, and they get shocked when they hear the price, it's going to come right out of their pocket. And they aren't prepared for that, because people just, unless their parents have been through it, most American people really don't understand this is where we could head into. So
Right, right.
So then what I do is it's the financial side of how do you pay for that, where's the money going to come from, and assist people to get on Medicaid and get rid of all the rumors. We've had some marvelous speaking engagements, Jan and I, like at St. Peter's Hospital, to all the discharge planners and social workers saying, if you learn anything today, would you please quit telling everybody you have to be broke and impoverished to get on Medicaid. It's not true. Get rid of the rumors. So we have a great time educating out there in public to how it really works.
Right. Okay, great. Thank you. And how about you, Janet?
Well, and so in the context of working with Laura and Bruce, I provide the legal issues that have to be addressed, and they're different. It's a case-by-case basis, and so if they come to me first, we're talking. If families come to me first, we're talking about what I will do for them, and then the other players and how it all fits together. The most critical thing from a legal aspect is that really good, current, comprehensive powers of attorney are in place. And so we do what we have to do to get that to happen right out of the chute. And then there are different things. Sometimes estate planning documents need to be adjusted when there's long-term care that's imminent. Transferring real property involves some legal documents, and there are just a variety of things to do. But that's my end of it. But it certainly does take a little team.
Right.
To make it all happen.
Okay. So I would guess that sometimes you're the person that has the client that then needs more help on the financial end or the legal end, but sometimes they come to you first and you refer to these team members kind of in the thing, and sometimes you're the entryway. Is that correct?
Yeah.
Okay.
That's the beauty of working, the beauty of having relationships with other professionals in the community is that we really understand what each other can offer, the gifts and skill set that we can offer. And so if someone walks into my office first, I know just enough about the legal stuff or the financial stuff to ask the key question, do you have power of attorney? And we can get them right off to Janet right away, if not. And I'm educating them about the importance of that and vice versa. So, yeah.
Right. Well, I know during the presentation at the senior center, there were a couple of incredible actors.
Yeah, there was amazing actors.
Yes, my colleague and I pretended that we were the kids of parents that were having some issues and having to make some decisions. My mother, I think, was already in the hospital and headed to a nursing home, and my father was totally confused about what to do and where to turn and was afraid he was going to lose all of his hard-earned money paying for my mom in care. So can you start out, maybe, let's say I came to you first, Bruce, what would you have me do in that situation?
Well, my opening question to everybody is tell me what's happening with just about every single person, so they can tell me like what you did.
Right.
With your,
Well, my mom had a stroke, and my dad's probably not going to be able to take care of her, and he's at home. They've got a really nice home and a couple of cars, and they've been saving. They've been prudent all their life. They have a pretty good savings account, and right now, Dad's just knows that nursing homes can be like $9,000-$10,000 a year, and he's just thinking, well, how am I going to afford that?
The two things that come in the office for, one, Dad is totally afraid of everything with his wife needing care, and that's a whole world because how is he going to take care of Mom through the future? But the other one is we're going to go broke. Everything we've worked for is going to go broke. So one of the most pleasant parts of my conversation is to let Father know that no matter what rumors you've heard out there in the market through all the resources, you will not go broke to get on Medicaid. They didn't design the laws to impoverish both people because one needs care. And I'll explain to him that there's legal ways to protect the assets, and even though it's not so publicized, you need Janet, you need a good elder law attorney to talk to. We need placement. We need to know where mom's going to go to after the facility. But the financial side, I want to get that fear out of father that he's not going to lose everything he's ever worked for. And I just feel them sit up, and they just feel so much better knowing they're not going to go broke. Yes, it's a process, but they're not going to lose all their assets. And that's so against all the rumors that are out there in the marketplace.
Yeah, okay. Well, and you know, as a daughter, I'm concerned about where my mom's going to go and whether my father's going to be able to visit her and get there. And we don't know what kind of care she's going to need, and where do we turn, and how do we find the place that's going to be best for her.
Absolutely. And so as a geriatric care manager, my role is to really look at each family holistically. And so I'm looking at medical diagnosis and prognosis. I'm looking at the financial pieces, the legal pieces. I'm kind of getting a big picture of what's going on. So one of the things is I'm concerned a little bit about how dad is coping with this. You know, there's a change in family roles. This is a real kind of crisis happening to the family. So how can we support the family emotionally? And then, like Bruce said, a big piece of what we do is just educating, dispelling those myths. So one of the big myths is your mom may never find a good place to go to if she's on Medicaid. And I can tell you, you know, I've been doing this work for many, many years, and there are phenomenal homes and options for folks that are on Medicaid. And it's just knowing where to find them and how to advocate. So that's a piece that we would definitely be looking at too.
Okay.
Yeah.
And Janet, I think another concern is I don't think my mom and dad have done a good job talking about planning and getting to this place. So what kind of conversation would you be having with us and with dad? Because they don't really have it all together.
Well, and so the variety of legal issues that come up are typically that I deal with the most are the family dynamics related to estates and inheritance and that type of thing. So that gets a little touchy.
Yeah.
But we have to address that and discuss what legally can be done to. The goal is to protect mom and dad and get the highest quality of care for the ill spouse, protect assets for the well spouse, and make sure that they can carry on. So I think I see my role just typically turns out to be legal advice in all of those areas, and it plugs in differently with every client, it seems to. But I certainly can't do it by myself.
Right.
So that's why we need all of us.
And one of the things that we often find is that folks they're not on Medicaid right away.
Right.
There's a process.
Yep.
Where sometimes there's what's called a spend down period. And so so again, we're really educating families, and we work a lot together in determining how quickly a person should be looking at getting on Medicaid. Again, we're kind of assessing, I'm doing an assessment with the family to determine the level of care that is really appropriate for their loved one. And then we're negotiating with some of these facilities, whether it's an adult family home or assisted living facility, about maybe our client can pay 1 year privately, and then we'll need to convert to Medicaid. Or maybe they can pay 3 months, or maybe they can pay 2 years. You know, we're doing a lot of communicating together as a team to make sure that we are meeting the need of the family, and they're not, the stress that can come with families in crisis, people just want to make the right decision, and they don't know what that is, and they really need guidance. And so that's why we're here. We're really here to help save folks from crashing and burning,
Yeah.
or from, you know, having to move 5 times, or losing all their money, or, you know, we're really there to advocate for the people in our community.
And I think it's really important. I mean, I try to stress this whenever I'm talking to people about long-term care, is to not wait for the crisis to happen, to proactively think about planning for it happening. And then if it doesn't, great. But if it does, you're ready.
Right.
And that takes a huge amount of the stress away.
Right. Yeah.
And with most of the facilities not taking Medicaid for 2 years, you know, most people don't realize that they're going to have to pay about $250,000 out roughly for 2 years of care. So where's that money going to come from? Are they going to sell their home to fund it? You know, so they have to be aware that finding immediate Medicaid beds is her specialty, and I couldn't do my job without her to help me find facilities and that to take care of people.
Yeah.
But sometimes it's definitely a couple years of private pay, and you got to get ready for it.
Yeah. Well, it's wonderful that we have experts like you, and I know there are other attorneys and there's other people, and I would say the Senior Action Network is a good place to reach out to try to locate the professionals that have the expertise. But I really love that it's a cooperative thing and that there's a lot of talking back and forth, and everybody kind of knows their specialty, but also where the limits of their specialty is. So I really appreciate how well you work together to help our older community.
You know, I'd like to encourage people to go out and research Senior Action Network. Go to the website, look at all the professionals, all the members of there, because you'll definitely find some great resources if you're out in the community versus trying to wonder where people are at.
Right.
It's a great
right.
connection to find
Yeah.
people through our system.
Yeah, and I've kind of told people that, you know, really if you go with people from Senior Action, it's kind of like they have that good housekeeping
Yeah.
seal of
Yeah.
approval
Yeah.
because they work together,
Yeah.
they know each other, they have similar values of the client being first, and it's just a really good group.
I've spoken with professionals from other communities, and they are always so surprised how well our community works together. And that's something that I think that we can really appreciate and value.
Yeah,
Definitely.
Yeah. See what you started, Bruce. You did well.
Well, somebody gave me a hint. They did it in Tacoma 20-some years ago, so we said, let's do the same down here.
Yeah.
Get them all, get everybody together.
Well, I really appreciate your coming out and just helping folks have a feeling that there's a hope if they're confused, if they don't know where to turn, that we do have great professionals in our community. Thank you so much.
Thanks for letting us be on
Again,
the
I'm
show.
going to
Thank
say
you.
your names one more time. Laurel Villencourt,
Laura, yep.
Bruce Bamford,
Bamford.
and Janet Moody. Thank you so much.
Thank you.
Thank you.
All right. And again, we want to say a big thank you to the folks here at Thurston County Media. We so appreciate your helping us get this good information out to the citizens of Thurston County, and especially those older citizens. Thanks so much. We'll see you next month.